My name is Macie Robinson and I'm in Foundation Lecture, and I'm going to be performing the catheterization on my male patient today. Just to run through my supplies, I have a waterproof pad to put underneath the patient, a towel to clean up the patient after the procedure, and my catheterization tray, as long as my hand sanitizer and my gloves are nearby. So I'm going to exit the room and enter and begin. Hi, my name is Macie. I'm going to be performing your catheterization today. Could you verify your name and date of birth for me? And I'm checking the patient's identity to ensure that I have the right patient. I'm also going to verify the procedure with the chart and the doctor's orders. Okay, I'm going to lift you up to a comfortable working position. I want it to be about waist height so that I'm not bending over like I am now. Okay, and I'm going to go ahead and put on some clean gloves. These aren't absolutely necessary, but I would prefer to have them on while manipulating the patient to get them ready for the procedure. So I'm going to fold the blankets back, not too far, but enough to reveal the working area, and lift the gown up. Okay, and I need my supplies to be right next to me. I'm going to lay this waterproof pad underneath the patient. Okay, and could you lift up for me? This will keep the bed linens from getting wet, so we won't have to change them after the procedure. Okay, and now I'm going to open up my tray. I'm going to put this bag at the end of the bed here for trash. Okay, and it's at this point that I can go ahead and open up the tray, and then I'm going to put on my sterile gloves. Okay, so now I'm going to take these clean gloves off, place them in the trash, sanitize, and open up my sterile gloves. Okay, and since I have both of my gloves on, I can now adjust them. I'm going to pick up the wrapper at the center and place it in the trash. And now I can start getting my supplies ready. Okay, so I have a few different pads here that I'm going to lay by the patient. And everything in the tray is sterile, so it's okay to touch with my sterile gloves. But I do not want to touch the patient with my sterile gloves. And place this around the patient's area. Okay, and now I can move my tray to my sterile field located over here. Alright, and now I'm going to get my supplies ready for the procedure. I'm going to open up my swabs. and have them nearby. I'm going to go ahead and open up the lubricant. And I'm going to, there is a specimen cup located inside of the tray. I'm going to remove the lid and put it just outside of the tray, as well as the label. Okay. And I'm going to insert the tip of my catheter inside of my lubricant to go ahead and lubricate. Alright, and now I'll begin to clean the patient. I'm going to use one hand to hold the genital area to begin cleaning the patient. And so I'm not going to move this hand since it is now considered contaminated, and this will be my clean working hand. I'm going to start at the top and at the center and slowly rotate down. And we use one swab only once. I'm going to trash this. And now move to my next swab. And again, only using it once, starting at the top and rotating down. And this will be my last swab, starting at the top and rotating down. And trashing. Okay, and I'm going to go ahead and trash that wrapper. So at this point, I'm going to take the lube and trash that wrapper, and I'm going to be inserting it 6 to 8 inches or until urine flows. And I'm going to let the urine flow into the cup to get the sterile urine sample, and once that's full, it'll just drain into the tray. So I'm going to insert. Now you're going to feel some pressure. Take a deep breath. And just bear down like you're urinating. And once urine begins to flow, I stop. And once the cup is full, I'll let it run into the tray. Okay, now we're going to remove the catheter. So take a few deep breaths for me. Okay, and now I am done with the procedure. I'm going to wad up the catheter into my sterile glove. And remove and trash them. Okay, and now I have my sterile sample. I'm going to sanitize and put on a clean pair of gloves to remove my sample. And I'm going to put the lid on. And I have the label, which I would put the patient's name, date, room number, and the instructions, and put on with the cup. And I could just simply dump out whatever urine is in here into the restroom. I'm going to go ahead and get all of this trash off of the patient. And remove the waterproof pad after I clean the patient up. In case any urine flew down or if any cleaner, removing just any fluid that might be there to prevent skin irritation and breakdown. Okay, and that will go in dirty linens. I'm going to remove this waterproof pad and go ahead and get the patient comfortable again. And I'm going to lower the patient. Now, is there anything else that I can do for you while I'm in here? Okay, and now I'm going to take my sample cup and get it processed. And I will shut the door behind me and sanitize on my way out.